If you work in a hospital, this video is for you. And if you consult psychiatry, this video is definitely for you. The most common consult request for psychiatrists in the hospital is to assess for capacity. Now, sometimes I get this consult request as assess for competency. So in the American nomenclature, capacity is a medical decision, right? It's a person's ability to make an informed decision. And competency is the degree of mental soundness necessary to make a decision about a specific issue, carry out a specific act. This is a legal word, a judicial finding made by the court, not by a physician. So unless you're calling me Your Honor, I'm assessing capacity, not competency. Now, capacity has 4 parts. As you can see, communication, understanding, appreciation, reasoning. I like to make an acronym, UCAR, to get all of them in there. And let's slowly go through what all of these mean. So communication is not just communicating a choice, but it's communicating a consistent choice. So it's almost like CC, communication and consistent. So for example, I have gotten a capacity consult before on a patient who is intubated in the ICU. They cannot communicate, thus no capacity. Understanding. Can you explain to me why you need IV antibiotics? So to some fair degree, a patient should have an idea of what the goal or what they're doing in their medical treatment. A is appreciation, meaning appreciating the alternative outcomes of what would happen. So if you didn't get the IV antibiotics, maybe the infection will get worse. If I do get the IV antibiotics, maybe the infection will get better. And then rationale, right? Can you explain to me the risks of not receiving IV antibiotics? Is there another treatment option you would like to try instead? Now in this one, right, the patient has a religious reason, but also understands that if he doesn't receive or they don't receive IV antibiotics, they would go into shock. But because of my religious beliefs, I cannot accept, so I would like to try oral meds. Now, that is a rational reason for rejecting the medical care prescribed. However, I have had a patient before who was very sick and wanted to leave the hospital, but wouldn't tell me why. When I eventually asked them, when I eventually got to know why, they simply just wanted to go outside and have a cigarette. Now, that is not rational reasoning to refuse life-saving and necessary medical care. And by the way, any physician can assess for capacity. You don't need the psychiatrist to do it. And stop consulting me for capacity to make general decisions. Capacity is for a specific decision at a specific time. I hope this was useful.